You know, I'd like to introduce our viewers to one of the specialists at David and Associates, Dr. Vladimir Jovic. Dr. Jovic is a prosthodontist, and you might ask, what is a prosthodontist? A prosthodontist is a specialist who's went an additional 4 years to dental school after dental school in postgraduate education to learn how to do difficult implant and reconstruction cases. So we're very pleased to have Dr. Jovic at our practice because one of the main procedures we do at David and Associates is involve complex implant cases, and Dr. Jovic has had expert training in doing complex dental cases. And so we also have a patient that Dr. Jovic has recently finished, Randy, and we're going to show you what we can accomplish with the Swiss Dent technique. So I want to have Dr. Jovic talk to Randy and go over what Randy wanted to accomplish when he came to our practice and what we exactly did on Randy.
One of the things that I do is I customize a plan. That's why I went back and specialized and really got the education to really do this, because a lot of dentists out there will just do their treatment, not really focus on the patient, just treat every patient the same. Everyone should be treated differently because everyone is an individual, and I try to individualize my treatment, customize my treatment. So when a patient comes in, it's more than just, hi, how are you? Let's do this and get it done. I'm already evaluating the patient as we're talking to them, be it looking at their smile, how much they're showing, looking at their lip support, if they've lost anatomical features, bone loss. There's all sorts of things that go into this. When I met Randy, he had some previous pictures that had some really bad teeth. Then he had a denture that was made, let's say, not the best. You know, I thought I definitely could improve on it, and I think we've done that with Randy. Randy, how was your experience?
I have to say, unequivocally, it's been one of the best experiences of my lifetime. I have my smile back. I have my confidence back. To have a deep-seated childhood fear of dentistry at a very young age, and then to finally get the courage to come into David & Associates Dentistry, automatically I felt comfortable. The staff was very welcoming. I felt secure. I felt safe. After my consultation, there was no more fear. And that was before anything was even done.
That's great.
The procedure went as explained perfectly, and I cannot tell you how pleased I am to be able to eat what I want, laugh, talk, smile, have my family and friends tell me what a beautiful smile I have. It's really given me my life back and my confidence back, and I'm so grateful.
You know, I think, Randy's on the show because he wrote us a wonderful letter about how it changed his life. And what we try to always accomplish is we want form, and we want function, and we want aesthetics. So it's, you can have aesthetics, but if you don't have incredible function, you still haven't accomplished, what we want to accomplish. Right. And that's what we're very lucky to have Dr. Jovic in the office, because as you can see from Randy, I think he's got an incredible smile, and as I think we'll show you his old restoration, it was an incredible change.
Absolutely.
What were you trying to accomplish, when you looked at Randy, and we've obviously seen his old restoration.
Oh, yeah.
And so what did you change? How did we get this incredible transformation?
So when Randy came in, it looked like the smile that he was showing a lot of lower teeth, which you see that kind of mimics older age when you have that. I wanted to give him a subtle look. I didn't want to give him something where he's showing too much, give him some nice lip support. And we can change things, not only just your teeth, but how your smile looks, how your facial profile looks. There's so many things that can be accomplished with this, but it takes the right evaluation. And, that's what I do. And there's multiple appointments that we do this in. And no matter what, let's take the time to do it right. There's no rush into getting you a beautiful smile, so let's do it right.
Yes.
I like to shake hands. I'm an outgoing guy.
Yep.
I like to look people in the face and project a confident image. For years, I just haven't been able to do that. It was like this. I couldn't laugh. I couldn't be a part of. Now, I have absolutely 100% confidence in going right up to people, big, beautiful smile, introducing myself. It's just totally changed my life.
Really, with the Swiss Dent technique, it's taken into account the patient's age, the sex, the facial profile. When we see patients coming in with dentures, what we're usually seeing is this flat, typical denture look. Real teeth aren't set flat. The bites overclose, so when you look at their facial profile, it ages them. Or what happens is when a patient loses their teeth, and you don't communicate to the laboratory technician where you want the facial profile to be, all of a sudden the lip collapses, and that's why a denture can age you 10 years. So we've had many people tell us with this twisted technique, it looks like they've had a facelift or a cosmetic surgery, because we really pay attention to how the facial profile should look. It's not just having the teeth look good. What you can do with the twisted technique is really build out the patient's lip. You can fill out the nasolabial folds. You know, in my practice, we do a lot of cosmetic fillers, Restylane and Juvederm. And with Restylane and Juvederm, we can get this look, but it lasts maybe 7 months to 12 months. But with a Swiss stent restoration, because we built the facial profile out permanently, this never goes away. So besides giving you a beautiful smile, I think when you look at Randy, what Dr. Jovic's accomplished, and what you saw from Angela, the patient that I recently finished, we can make a remarkable change in your facial profile, not just the smile, and we can also give you back the function so you can chew the food you want to chew with.
I wouldn't be afraid to pick up anything and eat it if it tastes good and if it's what I wanted. It's just that confident in my teeth, and it's just it's an awesome feeling.
Well, thank you.
It's almost undescribable.
Well, we appreciate having you on the program today. Thank you very much.
It's been a pleasure,
Thank
sir.
you, Dr. Jovic.
Thank you, Randy.